Also similar to autonomic dysreflexia, orthostatic hypotension typically seen in people with a high level of injury, above T6, mid-thoracic and cervical level of injury. Components of aging is also crucial to remember. We see it more and more in aging population with people with spinal cord injury, similar in able-bodied population. Be prepared that symptoms could be very profound, as we describe usually lightheadedness, dizziness, but it could be totally asymptomatic. Again, I would like to emphasize, do remember that baseline arterial blood pressure in person with spinal cord injury is already low, typically low, and drop by 20 could be significantly decreased further. At your office, you don't have tilt table, but you can do sit-up test using simple support from nurse or somebody, or from caregivers from the patient with spinal cord injury. And again, I truly encourage that in family practice, we have to try to have a plinth and examining tables that can go down to the level of wheelchairs that person will be able to transfer to the examining table. I can imagine that many of you will not have a lift for transfers. When to refer? That's why if all the management that you know in your reality, send to try to refer to the patient with spinal cord injury to specialists, and typically we as a physiatrist will provide some additional tricks and recommendations and so on. As I mentioned to you, longer duration of spinal cord injury in injuries with a low level could show recovery of orthostatic hypotension, but people with cervical and upper thoracic level of injury could show deterioration of this blood pressure dysregulation with aging. Symptoms will interfere with daily activities of people with spinal cord injury. Can you imagine that person who are lawyer or teacher coming to the work on wheelchair, and after 1 hour of prolonged sitting at the meeting without any activities, arterial blood pressure will go lower. Person become dizzy, lightheaded, cognitive function will be difficulties. This is typical what our patients will report to us. And of course, if person develops sudden loss of consciousness and really dizzy, send to emergency. It could require IV fluids or vasopressors.